Hello, my name is Hugh from HFHill Associates. Today we're doing another one of our videos in a series going over all the different tables and options. Today we have a brand new HFHill Airflex II. This particular table is Finesse Hershey on black. It is loaded with all sorts of features, but we're going to do the 2 cervical drops, Flexion, manual Flexion headpiece, thoracic, lumbar, and pelvic drops, manual flexion, auto flexion, and mostly we're going to emphasize the brand new touchscreen automation that Hill Labs has introduced in 2019. So it's very easy to use. You see all the listed options, and you would just simply touch on the screen and that would activate those 2 drops. You have a foot cocking strip. You have one on either side, and I'm going to go ahead and activate the lumbar and the pelvic, and I will step on it and we auto cock those 2 drops. Okay, so to unactivate them, you just touch them again, and we're going to go down to our Thoracic Breakaway, which I had open here. So you can lock it closed, nice and tight, or you can pull it open. And so we go to our pressure pedal here, and we take pressure out of it and push down. You see it gets smoother. Or we can add pressure back into it. Okay, pretty simple to use, pretty simple to lock. Okay, we're going to go backwards here and go to our Flexion. So this is our manual Flexion. And one of the very nice new features is it's self-calibrating. So you choose a patient's body weight that fits into any one of those 4 categories. The 100 to 175, 175 to 250, 250 to 300, and greater than 300. Okay, today I'm going to pick the small one, and it automatically calibrates the flexion cylinder back here to that particular body weight. And we go flexion. And if we hit, I'm going to put a piece of paper up here that's going to act like a patient's on there with some body weight, and we just hit open for unlock, and now I have my manual flexion going up and down. Okay, so I can always add pressure to it by just touching on the pressure pedal and adjust it inside of that category. Take it out, add it back in, and I can release my lateral flexion. And when I do that, I can get circumduction going on here. Okay, when I'm done, I can lock my lateral and lock my flexion, just like that, just a touch of a button. Okay, we're going to go backwards on our screen here and go over to distraction. And again, we just push on our same pressure pedal, and the distraction comes out. So distract your patient out, and the other side, we'll bring it back in. All right, pretty easy to use there. So the other features on the table, we have the foot cockers on both sides. We have our elevating foot pedal on both sides of the table, and it comes standard with 1 pressure pedal, but you can buy a 2nd pressure pedal for the other side. That's the basic Hill Elevation Airflex II Flexion distraction table. Thank you.